Welcome back to my session. Today, we will study health systems. By the end of this unit, you will be able to talk about the patient's general condition. Look at the slide. You have the following symptoms for a while: fever, loss of appetite, headache, tiredness, and a general feeling of being unwell. And you want to see a doctor. What's the first thing to do? Naturally, you make a medical appointment. How can you make an appointment with the doctor? You can make an appointment on the phone or online. What are the steps of visiting a doctor? If you want to make an appointment online, you need to follow some steps as in the diagram. First, you need to log into the hospital's website for registration. Then select a department you want to visit and arrange your appointment date. And then select your doctor and choose an appointment time. Now, you are ready to go to the hospital as you have an appointment with the doctor. At the hospital, you complete payments before you see the doctor, and finally, you wait for the doctor. That's how it works in general. Here we have a short dialogue between the receptionist and the patient. To do this task, open your booklets to page 22 and fill in the blanks with correct words or phrases in the box. After you read the conversation between Anna and the receptionist, look at the following prompts. Then play the part of the receptionist and the patient in turn. Appointment. Date 15 October, Wednesday. Time 11:30. Department. Internal Medicine. Dr. Helen Crow. Symptoms: fever, loss of appetite, headache, tiredness, and a general feeling of being unwell. Let's focus on hospital admission. What is inpatient? Hospital admission involves staying at the hospital at least one night or more. Sometimes you need to stay at the hospital for a week, 2 weeks, or maybe months, depending on your treatment. Inpatients stay in rooms, and they are called wards. Why do you think patients stay in the hospital overnight? Well, patients stay in the hospital overnight because they are too sick to stay at home. They require 24-hour nursing care. They receive medications, and they undergo tests and surgery that can only be performed in the hospital setting. What about the outpatients? Outpatients do not stay at the hospital. They come to the hospital, they attend a clinic, they have tests, they have treatment, and then they return home on the same day. Now let's learn new vocabulary. Look at the pictures and match the pictures with the words. Ward, operation, referral letter, assessment, put on a waiting list, discharge, treatment, on duty, admission. Let me explain 3 of them for you. Assessment unit. GPs, in other words, general practitioners sent their patients to other professionals for further assessment, and in this unit, doctors and nurses carry out observations and investigations and plan the diagnosis and treatment. So, picture 2 is assessment unit. Let's look at picture 4. Picture 4 is treatment. What is treatment? Treatment is the use of drugs, exercises, etc. to cure a person of an illness or injury. For example, treatments for cancer, treatments for depression, mental disorder, alcoholism, schizophrenia, eating disorders, diseases, etc. And picture 5 is a referral letter. Again, mostly GPs write a referral letter to other professionals. It gives a detailed summary of a patient's complaints and medical history. We will learn how to write a referral letter in the following lessons anyway. Now do the rest of the task by yourself. When you finish, go to page 25 and fill in the blanks with suitable words or phrases given on this page, on page 24. Okay, here we have the words we have learned: admission, assessment, discharge, operation, referral, and treatment. What about the verb form of these words? Admission as a noun, admit as a verb. Assessment as a noun, assess as a verb. Discharge and discharge as a verb. Operation, operate. Referral, refer. And treatment, treat. Let's see how we use these verbs in sentences. The patient is admitted to the hospital. The patient's condition is assessed by the doctors. Cancer is treated with drugs. Patients are discharged after treatment. If the department is not available, patients are put on a waiting list. The patient is referred to other professionals, such as psychiatrists. Now, fill in the blanks with the words in part A, B, and C, and then study the dialogue. Okay. In the previous slide, we have used passive structure. Why do we use passive voice, or when do we use it? We use passive voice when the subject is unknown. For example, my lunch is stolen every day. Somebody steals my lunch, but I don't know who steals it. In this sentence, the word lunch is more important than the word somebody. So it's better to use present passive for the sentence. We use passive when the subject is not important or less important. For example, the road is repaired. In this sentence, what is repaired is more important than who repairs it. We use passive when the subject is already clear. For example, he is arrested. It is clear that only the police can arrest him or her. So, instead of saying the police arrests him, we say he is arrested by the police. And finally, we use passive voice when the subject is people in general. For example, paint is sold in hardware stores. Who sells paints? Of course, hardware workers. We know that. So, in this sentence, the word paint is more important. So, instead of saying hardware workers sell paints, we say paint is sold in hardware stores. A passive sentence consists of the subject, verb to be, that is, am, are, was, were, etc., and past participle of the verb. In other words, verb 3, like sell, sold, write, written, treat, treated, etc. Now, study this table. Here is an example of how to make a cake. As you see, we use passive to give instructions. Butter is melted, then it is put into a bowl. Sugar and cacao are added. A half cup of milk is poured. Petitberg biscuits are crushed and added to the mixture. The mixture is placed on foil. The cake mix is shaped with hands. It is put in freezer and left for 2 hours. Okay, here is another example how to make chocolate cake. Okay, let's go back to our lesson. Let's talk about nurse's role. Here is a list. Which ones are the duty of a nurse? Put a tick. Here, if you don't know any words or expressions, please use your dictionary to complete the task. Let's see the duties. Which ones do you think are a nurse's role? Patient care, operating, checking temperatures, pulse rates, and blood pressures, giving injections, prescribing drugs, examining the patient, performing a test or a biopsy, providing pre and post operation care, changing dressings, and finally, removing stores. Okay, here is a useful vocabulary chart. Who performs an examination or who examines the patient? Of course, doctors perform an operation or doctors carry out an examination. Nurses perform a procedure or the procedure is performed by a nurse. Look at the other collocations and study them. Okay, here we have a short dialogue. Study this short dialogue first. Now, write a dialogue using the prompts and then play the part of the nurse. Give detailed explanations about the patient using all the information given in the box. We have an interview with a nurse. Before we read the interview, let's study these words. Administer. Administer means to apply or give as a remedy. In other words, to give someone medicine or medical treatment. Look at the example sentence. The nurse administered basic first aid, but it wasn't enough to save the patient. Assist means to help. Let's look at the example sentence. Nurses assist doctors. Direct care. Direct care means the care of a patient personally by a staff member. Here is an example. Direct care workers have good medical knowledge and the ability to work well with people. And finally, the word is drove. Drove means to extract or take, such as blood from a vein. Here's an example. Nurses drove blood and sent the sample for analysis. Interact. Interact means to act or work in close relation with another. Here is an example. Doctors need to interact with the nursing team to provide the best care for patients. Medication. Medication means the administration of medicine. For example, the nursing staff are responsible for the medication of patients. Dressings. Dressings means materials applied to cover a wound for the purposes of protection. For example, you have to change the dressings on the cut every day to stop infection. Midwife, a qualified nurse to deliver babies. For example, in the USA, most midwives are women. We have 4 words more. The first one is monitor. Monitor means to check constantly on a certain condition or action. For example, nurses monitor patients and take care of them. Rewarding means giving satisfaction. For example, nurses' salaries are quite low, but a lot of nurses say that they like their job because it is rewarding. Specimen is a small sample or part taken. For example, blood and saliva specimen are taken and then tested. The last word is staff nurse. Staff nurse means qualified nurse. There are 8 staff nurses working in the accident and emergency department. Now read this dialogue carefully on page 30 and then do the following tasks. As a post activity, look at the text and fill in the blanks with appropriate words. You may need to change the forms of the words. Okay, this is the end of Unit 2. Thank you for your participation.